Hi, welcome back to our channel. In this final video of our hospice series, we're talking about what to expect during hospice care. Let's face it, going under hospice is not an easy thing. I have a cousin who is struggling right now. He's really at the end of his life from colon cancer, and he is just having the hardest time accepting that hospice care is really in his best interest at this time. So I thought it would be good to make a video about what you can expect under hospice care, and hopefully that will help people who are trying to make that decision. Hi, it's Robin with SeniorSafetyAdvice.com. Tune into our channel for tips and hints to help seniors and caregivers with aging in place safely. So, why is it so difficult to discuss hospice care? Well, like I said about my cousin, a big part of it is that you have to then accept that really you are getting ready to pass away. And that obviously is going to be very challenging for anybody in that situation, as well as for their families. In some cases, the patient is actually ready to accept hospice care, but their families don't want to let them go. And it makes sense. It's very difficult to let someone go who you love. Another reason that it can be difficult is because going into hospice care means that there is no cure. You're transitioning from a curative thing, like in his case, he is on chemo right now, but the chemo isn't working. If he goes under hospice care, he won't be getting that chemo anymore. So he's going to have to accept that, again, this is not curative any longer. And another reason it's difficult to go under hospice care is because people really have a misconception about it. They feel like hospice care is only for when you're basically at death's door. But that is untrue. Actually, hospice care can be very beneficial both for the patient and for their family in their last 6 months of life. And so it isn't necessarily that you have to do it like when you're at the 11th hour. In a lot of cases, it's wise to get under the program when you are at that 6 month roughly time frame because there are so many benefits, which we'll talk about in a minute. So if you don't know what it is, hospice care is actually for end of life. It is comfort care. It is support for the patient and support for the family emotionally. And also there are some financial supports in that hospice will provide things like beds or wheelchairs, things like that, so that the patient and their family don't have to spend the money on it. And hospice care is also to help with pain management and symptom management. So a hospice care team is made up of doctors, nurses, social workers, chaplains, home health care aides, and volunteers who have undergone a special training program in order to help in that capacity. Hospice care is provided in the patient's home, like it was in my mother's case. It can also be provided in certain hospitals. A lot of them will have like a hospice wing or a hospice area. It can be provided in a nursing home or an assisted living, a facility type of a thing. And in certain areas, there are dedicated hospice centers where the patient would go to live for their final days. So, as I was saying before, there are a lot of benefits to hospice. They provide things for symptom management, for pain management. Like in my mother's case, they provided oxygen, a hospital bed, and a wheelchair for her. They can provide assistance with activities of daily living, like helping the person bathe or dress or eat. The program can provide emotional and spiritual support both for the patient and for their families. And sometimes, depending on the hospice program, sometimes they can also provide respite care so that the family caregiver can get a break. Hospice plans, the care plan is specifically created for each person. So what fits and works for one family may be different than what is working or fits well for another family. So a day of hospice care, what does that look like? A typical day? I'm going to read from my notes. Again, every situation is unique, so a typical day for one patient might look different for another patient, but this is a general way of looking at it. A nurse may visit to check vital signs and manage the person's symptoms. There may be a personal care aide who comes to help again with the activities of daily living. You may see on occasion a visit from a social worker to help, be sure that things are going smoothly and that needs are being met. There may be a visit from a chaplain or another religious person to help with that spiritual support that we were talking about. There could also be time for rest and for family visits. So, I mean, it's not always just people running back and forth and seeing to the patient. There are plenty of times that it's a normal day for the person. And then there can also be medication administration if that is something that's needed. So that schedule is flexible. It really just depends on what the patient and the family need at that point in time. So for family caregivers, hospice is, again, a place that, or a program that can help to provide respite care. It is also a program that offers emotional support. I know after my mother passed away, they had actually ongoing grief support as well. So we could join a grief support group, and then that lasted for an entire year where we were eligible to be able to go to that. Hospice offers 24/7 assistance for the family. So when it gets down to those final days, and the family has questions or concerns, they can reach somebody at any time of the day or night to ask about that concern or question. So as part of the hospice's specialized program, if you will, the care team works with the families because not only are they trying to be sure that the patient's needs are met, they're also trying to be sure that the family is emotionally supported and that their needs are being met during such a difficult time. Some of the misconceptions about hospice that are untrue is that, again, it has to be only for your final days of life. That is not true. The person can be put under hospice care when the doctor feels that there are 6 months or less of life remaining. But if that person reaches that 6 months and they're doing well, they're still here, that 6 month period can be renewed again. So it isn't like it has to be just for those final few days. Being under hospice care does not mean that you have given up hope. It's simply more of an acceptance that you are in this more final stage of life. But again, just because you're under hospice care does not mean you're imminently dying tomorrow. So it is helpful for both the patient and the family to be put under that program when there's plenty of time for decisions to be made and comfort care provided and things like that, rather than scrambling at the 11th hour and going under hospice care. One other thing I should point out is that hospice care can be stopped at any time. So let's say you go under that hospice care and you think you have 6 months left to live. And then let's just say things change and suddenly you're doing a lot better. You can stop hospice care. You don't have to continue it. So that is another misconception too. Once you're on it, you're always on it is what people think, but that isn't really true. It can be stopped. So the next thing I'm going to read from my notes, but it is, how do you have that conversation with a person if it is time to really consider hospice care? Again, my cousin right now who's struggling and clearly at the approaching the end of his life, he right now is flatly refusing hospice care. He wants every treatment that can possibly be given because he's afraid. And I understand that. But his sister, my cousin, who's been his caregiver for the last couple of years, feels like it's time to really address that he should be undergoing hospice care. So one of the first thing that you would do is make sure that you address this at a quiet time when people are not upset about things. It's a quiet moment to just say, hey, I'm wondering if now is a time to maybe start considering something like hospice care. You also want to make sure that you're expressing, love and kindness for this person. You want to use I statements. I feel like maybe it's the time to discuss this. I feel like maybe we should look at this and see what benefits they would provide, things like that. Also, make sure that you're validating the person's concerns and their emotions. They're the ones who are in that final stage of life. They're the ones that have to be able to accept it. So don't try to just push your thoughts on them. Acknowledge how they're feeling and provide emotional support for that. Another thing is to avoid using medical terms and jargon. You don't want to use words that are 8 feet long that the person can't understand. Make it simple so that they do understand what you're talking about. And you also want to ask open-ended questions. How are you feeling about where you are right now? How much pain are you in? Do you think it's time maybe to consider hospice? You also want to be honest but gentle with them. This isn't the time to force your beliefs on them. They are the person who is going through this final process of life. And so really, again, it's not about you, it's about them. I know right now my cousin, his sister, is very concerned about him. She's very adamant that really he needs to address hospice care, but it isn't about her. It's about him and what he wants to do. And so, like I told her yesterday when we talked, she needs to kind of take a step back. It needs to be on his terms, not on hers. And again, you want to offer reassurance. It's something that you're planting that seed today. Maybe that person is not ready yet to accept hospice, but it's given them something to think about. And you can just say to them, that's fine. I can understand you're not ready for it yet. We can always revisit it in the future. What I'm trying to say is, again, don't force the issue. Try to approach it with the kindness and compassion that you would want if you were in that same situation. Do keep in mind that if having a conversation about going under hospice care is too difficult for you, you can actually have a healthcare person, a member of the healthcare team, address that with your loved one instead of you having to do that. So, some people are just not comfortable talking about something like this. So it is actually all right for you to ask their primary care doctor if that person would have the discussion with with your loved one. Another thing you could do is if there's a close family member or friend who's a nurse or something like some type of healthcare provider like that, you could ask them to address it with your loved one. It doesn't all have to fall on your shoulders. So I hope that this video has helped you understand the hospice program a little bit better and what to expect a little bit more. I hope it makes it a little easier if you find yourself in this situation. We do have some good resources on our website, which I'm going to link down below. So if you need any more information about hospice care, please visit those articles and hopefully they'll answer your questions. If you like the video, please give us a thumbs up and then also subscribe, which is over in the corner there. That way you're not going to miss any of our helpful hints and tips and other videos. And if this video is something that someone needs to hear, please share it with them so that they can get that information as well. So thank you very much for watching. Until the next video, take care. Bye-bye.